HHA Practice Test 2026 Home Health Aide, Full Course Hair Nail Foot Care Guide. Question 1. Which of the following is true about foot care for a diabetic client? Soak the feet in hot water for 30 minutes. The HHA should never cut the client's toenails. Apply lotion between the toes. Use a sharp razor to remove calluses. HHAs are generally prohibited from cutting the nails of diabetic clients due to the risk of infection and poor healing. Question 2. What is the first step in providing hair care? Brushing from the roots. Washing with very hot water. Asking the client how they like their hair styled. Cutting any tangles with scissors. Always promote autonomy by asking the client's preference first. Question 3. How should an HHA brush tangled hair? From the scalp down to the ends. From the ends up toward the scalp. Only use a fine tooth comb. Pull firmly to get the knots out. Brushing from the ends up prevents unnecessary pulling and pain. Question 4. When providing foot care, the HHA should observe for redness, sores, or swelling. The brand of shoes the client wears. The length of the client's socks. The color of the floor. Monitoring for skin breakdown and signs of infection is a key HHA responsibility. Question 5. Why should an HHA avoid using powder after a bath? It is too expensive. It can cause slip hazards and respiratory irritation if inhaled. It makes the skin too oily. It changes the color of the skin. Powders can be inhaled and also cake in skin folds, causing irritation. Question 6. What should the water temperature be for a foot soak? As hot as the client can stand, around 105 degrees Fahrenheit. Ice cold. 120 degrees Fahrenheit. Water should be warm, 105 degrees Fahrenheit, but not hot to prevent burns. Question 7. Which of the following is part of nail care? Cleaning under the nails with an orange stick. Painting the nails with dark polish. Using a metal file to sharpen the nails. Applying heavy grease to the nails. Gently cleaning under the nails is part of basic hygiene. Question 8. When is the best time to perform nail care? Before the client eats. After the hands or feet have been soaked. Right before bed. Only once a month. Soaking softens the nails and cuticles, making them easier to clean. Question 9. What type of razor should be used for a client on blood thinners? A straight razor. A disposable safety razor. An electric razor. No razor at all. Electric razors reduce the risk of nicks and bleeding for clients on anticoagulants. Question 10. How should an HHA shave a client's face with a safety razor? Against the direction of hair growth. In the direction of hair growth. In a circular motion. Using cold water only. Shaving in the direction of hair growth prevents irritation and cuts. Question 11. What should an HHA do if they accidentally nick a client while shaving? Cover it with a towel and leave. Apply pressure and report it to the supervisor. Tell the client it was their fault for moving. Put lotion on the cut. All injuries, even minor nicks, must be reported and managed properly. Question 12. Which of the following is a sign of poor circulation in the feet? Warm, pink skin. Cold, pale, or bluish skin. Fast nail growth. Sweaty feet. Cold or discolored skin often indicates circulatory issues. Question 13. Where should lotion not be applied on the feet? The heels. The tops of the feet. Between the toes. The ankles. Lotion between the toes can cause moisture buildup and fungal infections. Question 14. If a client has very thick, yellow toenails, what should the HHA suspect? Normal aging. A fungal infection. The client is wearing shoes that are too big. The client is eating too much protein. Thickened, discolored nails are often a sign of a fungal infection. Question 15. How often should a client's hair be brushed? Once a week. Every day. Only after a shampoo. Only when visitors are coming. Daily grooming maintains hygiene and prevents matting. Question 16. What should an HHA do before discarding a used disposable razor? Rinse it and put it in the trash. Place it in a sharps container. Put it back in the package. Give it to the client for later use. Used razors are sharps and must be disposed of in a sharps container. Question 17. What is the purpose of a bed cradle in foot care? To help the client sleep. To keep the weight of the covers off the feet. To wash the feet. To exercise the feet. Bed cradles prevent pressure on the toes and feet from heavy blankets. Question 18. How should fingernails be shaped? In a sharp point. Straight across or slightly rounded. Very short into the quick. In a zigzag pattern. Rounding the edges prevents snagging and scratches. Question 19. A client refuses to have their hair washed. What should the HHA do? Wash it anyway while they sleep. Respect the refusal and report it to the supervisor. Tell the client they smell bad. Call the client's children to complain. Clients have the right to refuse care. Question 20. Why is foot care so critical for the elderly? To make them look younger. To prevent infections that could lead to amputation. Because they can't see their feet. To improve their sense of smell. Infection and poor circulation in the elderly can lead to severe complications.